Here's another 90-90 hip lift progression. Once we begin to get stabilizing control of the pelvis with the hamstring on the deficient side, we can begin to challenge that side a bit further and lock in those gains. This will free up the hip joints, the sacrum, and the lumbar spine, decreasing compensations that lead to overuse injury along the entire kinematic chain. This progression is exactly like the foundational 90-90 hip lift exercise, with the addition of pulling the opposite foot away from the wall before breathing begins. This will require more stability from the hamstring on the deficient side in the presence of reciprocal activity on the opposite side. In this video, the hamstrings on the left are pulling down, while the hip flexors on the right are pulling up toward the head. In other words, we're training the side of the dysfunction, in this case, the left side, to achieve dynamic stabilization and better support athletic activity so that the opposite side can move freely and independently. Think of a sport where you have to change direction quickly. If both sides are not equally supportive or responsive, that person is at an increased risk for injury. Once again, remember that I'm pulling down on the wall with my heel by engaging my hamstrings, and I'm working to ensure I do not push with my hips or my quads. Also, the abdominals need to be relaxed. The movement here should not include an abdominal crunch. So let's begin. Find an open space close to an open wall and take your place on the floor. Lie on your back with your feet flat on the wall and your knees and hips bent to 90 degrees. Make sure your head is well supported and you can relax. Place a 4 to 6 inch ball between your knees. Inhale through your nose, exhale through your mouth, performing a pelvic tilt so that your tailbone is raised slightly off the mat. Keep your back flat on the mat. In this case, we're focused on improving lumbopelvic control with the left hamstrings. As you maintain the hip lift, pull the right foot off the wall just 1 to 2 inches. Now that you're in position and your foot is pulling down on the wall, not pushing away, breathe in through the nose and out through the mouth. Be sure to purse your lips as though you're blowing out through a straw or blowing up a balloon. Lengthening the exhale and using your diaphragm is key. Perform this exercise twice a day for 4 repetitions with 4 breaths as you hold the position of each repetition. Are you wondering about low back, sacral, hip, or knee pain that somehow feels connected? Are you wondering if this exercise is right for you? With an accurate diagnosis, targeted corrective strategy, and consistency week to week, over time this can be corrected. It may take a while, but stick with it. It will happen. Click the schedule button. Let's make sure you're not wasting your time practicing exercises that may not help. Thanks for watching. I'll see you here again soon.